You should not start today. Oh. You should not start today. Off your mind and remove those videos. You are not selling market here. People should work today. Oh.
No, they are making noise.
Rather than making noise, anybody who understands the yesterday lectures can put us through now.
That is the best. I'm coming and check out.
Please, this Mr. Sani Mohammed, please off your video. The light is distracting, is entering my eye, please. I have eye problem.
Oh, no money. Yeah, I guess. Where is it? Come on, go with it.
Wasu lokacin ka yanzu za a yi mun additional bayan da mun kawai yanzu mun kawai lecture yanzu ga kare biyar mun kawai ta yanzu yayin da ma mun fara yanzu.
They want to go first. When she comes, and they come by here. And they come
Good afternoon, everyone. Please, can Adamu Manu turn off his mic? Ntago, Enoch Abigail, please turn off your mic. Sani Mohammed, DJ, please turn off your mic. Thank you. Sani Mohammed, please, we are still waiting for you. Ntagbo Enoch Abigail, we are waiting for you. Please mute your mic.
Who's specifically I'm come for?
If there is a co-host, can they remove them from this call, please? Can they be removed? This Sani Mohammed, please, can we remove him? This reflection is entering my eyes.
Okay. Don't mind me, darling. And I put on daddy. Okay, bye-bye.
Pastor David Onwuma, can you please mute your mic?
Oh, you woman. I do. Apa. How this child for do? Madam Abigail, if you dey go market, if you won't go do hair, I beg come out for this class today. I no want hear this one. Oh. Come out for class. That means you are not even hearing that they are saying you should mute your mic.
Mr. Sani Mohammed, please off your video. Off your video, please.
Let her off the video. Wallahi, true.
Mr.
Good afternoon, everyone. If you can hear me, just put on the chat box. Yes, because I have decided to mute everyone. I've been around at 7. I wanted to wait a few more minutes for others to come.
Milo, please, you return the host right there whenever Oga gets to class. The lecturer comes to class. I think his network issue, so the host has been given to you since you're raising your hand. So please, whenever Oga comes, return the host right to him.
I wasn't raising my hand as the rep, but I wanted to ask question. But let me just go and meet everybody safe.
3 at station 8. Now serving phone number 4292 at station 6.
Mute your mic.
Into the house, all around Lord, I see your power, I see your power. There's something about
So then I told
the
you that
things
start talking.
of
So can we know how to mute?
Please,
Send us to mute.
click on
Are
my
we
this
in the
thing. You are
church
not
or
your
we are
phone,
in the
please.
class?
Can you hear
Emma,
me?
What is
there.
happening now? You people should mute your mics now. What's the meaning of all of
What's
this?
going on here? Click on my this thing. You see council Othello that is talking. Please click on my name and make me a host. Or make me a
The
co-host.
person I was giving the hosting post yesterday should please mute everybody.
Everyone.
Please, is Prof still here? Let me unmute. Let me make him the co-host. It's like Prof. It's like Prof is not. It's like Prof is not around. I cannot make Prof co-host because I cannot see Prof. It's like he's not around.
Maris,
Yeah.
please. Okay. Unlock the meeting. He said you locked the meeting and he's not able to join. He's chatting me and he's saying he was not able to join because you have locked the meeting. So please unlock the meeting so that he can join, please. You can do well to unmute everyone, then let him join, after which he joins, and then you meet everyone back. I think that way is going to be fine.
I've unlocked the meeting. I've muted everyone also. Prof can join.
Okay, I'm back. Can you all hear me? I'm back. I was locked out. I don't know for whatever reason.
Yes, Prof, we can hear you.
Okay, I hope we can maintain a decorum this time. Please, everybody, I don't think it takes rocket science to mute ourselves, only to talk when at the end of the lecture when we are asking questions. I don't know whether that is a big task, but if who is Sani Mohammed? Is Sani Mohammed here? Okay, host, take out Sani Mohammed. DJ, take out Sani Mohammed. And there's someone else who has a A123. If you cannot rename the device, we want to see your name. Host, if you cannot take it, please take that person out also. So that let's introduce some sanity. Take them out. Let's introduce some sanity. Enough of this rubbish. Nobody forced anybody to be here. It is by choice. So we are trying to be strict and now let's all be more reasonable. All right. So let's go. Let me share my screen. We have two topics today. Let me start with the one that I think can be a little bit. The other one is just so straightforward. I don't know. Let's start with this other one. Now that you are slightly fresher, you can see the screen. All right.
Yes, Prof.
All right. So if you can see the screen, let's go. This other, I decided to start with this because of from my previous years of experience, I see that a lot of people have issues with them. I believe some of you would have read this topic. Let me just believe that by faith. But okay, we're talking about the concept and theories in disease causation. There are several theories about disease causation. Yesterday, I talked about the agent, host, environment concept or model of disease causation. And I said that has some limitation when it came to non-communicable diseases and some other even communicable diseases. So it doesn't answer every question. And that is why, you know, medicine, like every other science, is growing. People are asking questions. People are trying to strive towards perfection, since it cannot answer all the questions that come up. So scientists, people have been struggling to look at other models that can answer the question. That is why other models like the causal pi and the causal web theories also came up. So today we are going to look at these ones. If you read it, then it will be easier for you to follow. But if you did not, no problem. I will try and as much as possible to make it clearer to you. The second lecture, that one is very straightforward and simple, and so I can easily run through that one faster. So the concept of the cause of disease is complex, very, very complex, and subject to controversy. So a lot of debate in literature. Now, for the purpose of this course, we'll define the cause of disease as a factor or a characteristic or a variable, something that can vary, that influences the occurrence of a disease. And for instance, if such a factor increases, then there's an increase in chance of disease causation. And if such factor decreases, then the chances of disease causation also decreases. So if we can find such a fluctuation, then we can say that yes, this is, likely cause of that disease, because when the factor increases, disease increases, and when the factor decreases, the disease also decreases. 1 minute. Okay. All right. So, sorry, I could not lay hands on the PowerPoints, this thing. I don't know where I lost it, so I used to use the PDF format. Okay, now, a variety of models. We'll talk about the first one, which is the agent-host environment. So we're not going to dwell on that. We've talked about agent-host environment and interaction of these three components to produce a disease. Okay, so let's just go. You can just read this way. You know what the host is. The host is the individual. The agent is either the microorganism or bacteria or virus. And the environment is the environment, the interplay, maybe, where it thrives and all that. So the environment can be physical, chemical, biological environment. Physical environment, it can be climate. I remember I told you about disease causation as a result of weather, flooding, hot climate, cold climate, and things like that. Those are just physical environment. Let's go to the causal pies. Okay, the other model is the sufficient cause model. The sufficient component cause model, or alternatively, we call it the causal pies, the sufficient cause model or the causal pies. This model evolved because we could, the agent-host environment model could not give sufficient or complete explanation to disease causation. So this is a newer model that emerged. Now, this newer model is proposed by one Rothmans. So it's called Rothmans causal pies. So he brought up that a disease is caused by different sufficient causes, that no single disease is only caused by a particular cause, sufficient cause. So he gave examples. For instance, if somebody is in a place whereby somebody is infected with tuberculosis, the person might have that tuberculosis or might not have that tuberculosis. Other people might have that tuberculosis, contract it, others might not. What he's saying is that the TB bacteria is just one component. There could be other components that will facilitate the causation of that disease. And for that reason, some people can contract that disease, others cannot contract that disease. And that is true. Because most times, if a child, maybe any of your children, you would have observed maybe a child brings measles to school, to the class. Some other children contract measles and is spread. The rest, other children, don't contract measles. If it is not for this, then it means that once a child brought that measles, every other person must contract it. But it is not so in practice. And the question is why? So Rothman is saying that there could be other reasons that make somebody contract disease other than one particular component, which is that measles virus. But if maybe among all the several reasons, and that measles virus must be included in every other reason where measles develop, then we would treat measles as a necessary cause. So by his theory, you can see these three pies. Well, those of you who love pizza, you can see these are pies from a cake or a pizza. A, B, C, D, E. A, B, there is no C, F, G, H. A, C, F, I, J. So if you look at these pies completely, by that theory, by sufficient cost model theory, he's saying that the first one, sufficient cause 1, is sufficient to cause a disease. Sufficient cause 2 is on its own is sufficient to cause a disease, and sufficient cause 3 is sufficient to cause a disease. When you look at those pies, you see A, B, C, D, E. These are components, component factors, maybe environment, maybe poor nutrition, maybe genetic predisposition, maybe old age, maybe exposure, whatever these causes might be. So each of these causes might vary. That is why you see A, B, C, D, E. Here A, B, F, G, H. So it means that in causing that disease, several factors can be responsible. We might not know all the factors. It's not mandatory for us to know all the factors. We only need to know 1 or 2. Okay? In fact, even 1 is sufficient. So what this theory is saying that of all these sufficient causes, if you observe, 1 is constant. For instance, in the first pie, A is there. In the second pie, A is there. In the third pie, A is there. Other ones vary. For instance, now, in the first pie, B is there. In the second pie, B is there. But in the third pie, B is not there. In the first pie, C is there. In the second pie, C is not there. In the third pie, C is there. Just like that. For instance, now, D is in the first pie, is not in the second, is not in the third. E is in the first, is not in the second, is not in the third. F is in the second, F in the third, F is not in the first. So it can vary. Now, irrespective of whether they are there or not, what this theory is saying that each of these complete full pizza of infections or components will cause the disease on its own. So sufficient cause A will cause the disease. irrespective of the various components inside it, which are factors. Sufficient cause B will cause, 2 will cause, and that of 3 will cause. So that is what this theory is saying. Then each of these pi is a component. But that very factor, which must be present at all times for the disease causation to take place, is now called the necessary cause. So the whole gamut of factors is called the sufficient cause. The individual components of factors are called the component causes. Then the particular one that must be present at all times is called the necessary cause. So now let's go into live examples. So for TB, for instance, to occur, we see that maybe somebody who is not immunized, absence of BCG vaccination, poor environment, poor nutrition, crowding, then exposure to TB bacteria. So these components, these various components are present, and exposure to bacteria is also present. Now, for instance, if we replace some of these components, maybe somebody is not vaccinated, fine. Somebody's ventilation in the house is not poor, good ventilation, okay? And maybe not crowded because good ventilation. But in place of this poor ventilation and crowding, we have maybe somebody who has been ill, maybe of diabetes, of hypertension, or chronic kidney disease, replacing one of them. And replacing poor ventilation, we have maybe somebody who is very early. Under these conditions, you see that the why? In a sufficient cost model, several components will be there, but one particular component is the necessary component without which the disease might not occur. Okay, so that is what that's how that component is explained. Then we look at another example, say for HIV. For HIV infection to occur, it is possible that somebody is engaging in risky sexual behavior that is without protection and exposed to somebody who is infected with the virus. So somebody who is infected with the virus, engaging in risky sexual behavior, and maybe somebody who is exposed to the virus is not taking antivirals for viral suppression in order to bring down the viral load in such a way that in such a level that is not effective. So if these conditions occur, then the person is likely to contract HIV. You see, so this issue now is that whenever a disease occurs, what we should be looking at are what are the necessary causes of all the component causes. Even if we don't know the necessary cause, if we don't know the necessary cause, it does not also very much matter. So we use this in the control of infectious diseases. And the teaching here is that of all of these components, the epidemiologist must not wait to identify the necessary cause. But if one cause, please put down your hand. You can only ask questions when I've finished, please. I'll give you sufficient time to ask questions. If one of those components is known and removed, then the chances of controlling that disease is there. Just as in the, if you remember, I told you yesterday that the host environment and agent interaction, whenever we're able to break that link, then we're able to, we'll be striving all our efforts to control such infection, outbreak, or epidemic is to break that link, that relationship, host environment and agent relationship. All we are going to do, all we strive to do is to break that relationship. And once we're able to break that relationship, then control is in sight. We will make sure that other people will not contract that disease. So that is how it works. When we are looking at, we just look at what will help us break that chain or remove any of those components that is vital for the disease to occur. A single component cause is rarely sufficient to cause disease by itself. You see, a single component cause. Maybe now, that is why you can see, maybe somebody comes from a house where and has TB in that home. Until the person gets cured, you find out that no other person contracted TB. It is possible that their nutrition is good. Because their nutrition is good, their immune response is reasonably high to contain that, to fight back that Mycobacterium tuberculosis. Or it is possible that they have vaccinated already. Or it is possible that, oh, ventilation is good. If somebody is in the house and ventilation is good, very good, no crowding, and somebody has TB, he might not contract TB. You know, so what he's just trying to say that one cause may not always be sufficient to cause the disease. It causes rarely. There are other things that aid the causation of that disease. Maybe either somebody is immune compromised, or somebody is suffering from other diseases, or some other social conditions that are not favorable, will all put their hands together to ensure that that disease now comes. So many times, it's not only that the presence of that bacteria that will cause the disease. So that is what this causal pi theory is trying to explain. Okay? So I've explained it in a nutshell. I will now answer your questions at the end of the lecture. I will answer all your questions. So I believe you will have read it a bit, then you can have this in. So let's go to the web, causal web theory, web of causation. Here, we use this one mainly for non-communicable diseases. This theory speaks more for non-communicable diseases, infectious diseases, and non-communicable diseases. The reason here is that for non-communicable diseases, because of their nature, it is difficult to identify when they commenced. For instance, if somebody has hypertension, many times you would have heard that they say that hypertension is a silent killer. Before the hypertension is diagnosed, for instance, it is possible the person has been hypertensive for even 5 years without he or she knowing it. The same thing with diabetes. Many times you will hear that, oh, somebody died in his or her sleep, and you begin to wonder what would have happened. Many times from medical science, we know that there would have been some illness going on that the person did not pay attention to or sufficient attention to. Right. You see, so, and that happens mainly in non-communicable disease. That is why in incubation period, we say, in infectious disease, we calculate incubation period. That is the time the person contracted the disease and the time there was manifestations of signs and symptoms. But it is not so in non-communicable diseases. And why is it not so? We simply do not know when the non-communicable disease commenced. But in communicable diseases, we might know when exposure took place. We might know when somebody ate contaminated food. We might know when somebody was in a particular environment that was not wholesome. But in non-communicable diseases, we do not know. So over time, it's been found out that in non-communicable disease, there is difficulty in pinning it to one particular point. When you say hypertension, the first thing people say, I had a friend, and when he was saying that he was diagnosed of hypertension, the other one asking, what are you thinking about? It is not only about stress that causes hypertension. There are other conditions. For instance, you don't know if the person has some chronic kidney disease or some kidney infection or some endocrine infection. These are all possibilities, So it is not only about one cause. So since it's known that several causes come together to cause communicable disease, that is why it's called a web. A web, that is a combination of several factors. So when you look at this chart now, this diagram, as you can see, when we look at a myocardial infarction, that's heart attack. Heart attack can come from changes in lifestyle. It can come from smoking. It can come from stressors, stress factors. Okay? It can come from aging. That's how it can come from several angles. For instance, lifestyle changes, lifestyle factors, for instance, things like abundance of food, lack of physical exercise, smoking in addition, can trigger up thrombotic tendencies. That is formation of thrombus in the blood vessels. And those thrombus can block the coronary vessels, coronary arteries. And coronary arteries are the arteries that supply the heart itself with blood. okay? And that could, if they are occluded, when they are blocked, blood can no longer flow. And you know the most important function of the blood is carriage of oxygen, you know, to perfuse tissues, tissue perfusion. Those areas of the heart will begin to lack blood, become ischemic, begin to die, and can burst because they are dead cells. It can come the other way. Abundance of food can lead to obesity. It can lead to hyperlipidemia. That is things like low density cholesterol and all that in the bloodstream. Terrible lipids. It can lead to atherosclerosis. These are conditions that narrow the blood vessels, eventually block them because they are laid on the walls of the blood vessels and gradually narrow them. And when they narrow them, the pressure in the blood vessels increase. Not only as they narrow them, they become rigid. They alter the consistency of the blood vessels. Normally, blood vessels are pliable. When pressure increases, they expand. When pressure decreases, they contract. But when they become rigid, when the pressure in them increases, they will break. You see, when blood vessels are narrowed, again, supply of oxygen becomes difficult. Tissue begin to die. So it can come in different changes. Aging is another process. Aging process has potentials to affect the cardiovascular system. One, the process, okay? And that is known. So it will cause changes in arterial walls, and those changes are mainly from atherosclerosis because of the aging, those deposits and the same thing. So it can come in different ways. That is why it's a web of causation. Well, here the emphasis is saying that when somebody is affected by a non-communicable disease, then most times it's associated with several causes, several component causes, a web. That is the theory of web of causation. So those are the three ones: the agent, host, environment theory, the causal pies or the sufficient cause model theory, and the web of causation. The web of causation and the agent host are more straightforward compared to the causal pie or sufficient cause model. Then the other one is causality. Causality. The issue of causality for disease causation is never taken lightly in medicine. No, because of all these things I've said. And for that reason, a set of criteria was developed to infer causality. Before we say A caused B, there must be certain criteria that must be met, without which we cannot say that A caused B, or these exposures caused this outcome. And the person who propounded is Bradford Hill. We'll call it the Hill's criteria of causality. So Hill brought out some criteria, okay, about 8 or thereabout, or 9, but having. The first one is strength of association. So he's saying that for us to infer causation, then there must be a strength of association. How do I mean? A strength of association is a measure of the risk, the size of the risk which the person was exposed to. That if the risk the person was exposed to was high, sufficiently high, then we can say yes, that exposure led to that outcome. So we use things like the odds ratio, the relative risk, or standardized mortality ratio to measure it. Let me explain what these mean. For instance, the relative risk or risk ratio. Maybe it would have been easier for you to understand this when you have started looking at study designs. If maybe, let me paint a scenario. Let me paint a scenario for you to understand the strength of association here. If we have two sets of students and we want to follow them up over time, we have two sets of students. One set of students from 100 level, they entered school, they were smokers until they graduated, and 20 years after, they have been smoking. So on the total, maybe they've smoked for about 30 years. And the other group we followed are people who have not smoked for that same period of time. Then we examine them critically to look at their lungs and their lung function, capacity, vital capacity of the lung, or any diseases that might occur in them. If our disease of interest is lung cancer, for instance, then we find out that among those who smoke, assuming they are 100, we followed, and among those who did not smoke, we also followed 100. Then of the 100 we follow, 10 developed lung cancer. Among those who smoked, 10 developed lung cancer. Then among them who did not smoke, 1 developed lung cancer. Among those who did not smoke, or say 2 developed lung cancer. So we'll look at the probability, the chance of developing lung cancer among those who smoke. It will be 10 over 100. Okay? 10 over 100. And 10 over 100 is, 0.1. 0.1, that's 0.1. 10 over 100. Then among those who did not smoke, 2 developed lung cancer. So out of that 100, 2 developed cancer. Then if we look at the chance of developing lung cancer, the risk of developing lung cancer in that particular group who did not smoke is 2 over 100, which is 0.02. So we calculate the relative risk. The incidence of the disease in the exposed over the incidence of the disease in not the exposed. The incidence of the disease is just those cases that develop disease among all the people that are exposed. The first one is that 10 people developed the disease among all the people that were exposed to lung cancer. 10 people, that is 0.1. Then the incidence among those who did not smoke, 2 people, because we say that it's not, lung cancer is not, smoking is not the only reason why lung cancer develops. There are other diseases that can cause lung cancer. So in that case, we'll calculate the relative risk with a simple formula. Incidence of diseases in the exposed over the incidence of disease in unexposed. And that will be 0.1 divided by 0.02. That is going to be 0.1 over 0.02. And that will give us 5. Then we'll say the relative risk is 5. Once the relative risk is 5, then we say there is an association between smoking status and the development of lung cancer, which means our conclusion would be that the development of lung cancer is 5 times higher among those who smoke compared to those who did not smoke. So the strength of association is saying that here, the risk of developing the disease is high among those who are exposed to that disease compared to those who were not exposed to that disease. So that is one which means the higher the exposure to that disease, the higher the risk of developing that disease. That is one condition in Bradford-Hill's disease. That's relative risk. Odds ratio is the same thing as relative risk. Odds ratio is just a situation that we looked into what happened in the past. If you follow the explanation I gave about relative risk, I'm only saying that if we follow people over time in the future, but in case of odds ratio, if we look into their history in the past, if we just look into their history in the past and see if they were exposed to this in the past, and now what that in that case, we are calculating odds ratio. Whereas, and why is it so? Because we are looking at the probability of occurrence. We are looking at the chance, the probability. But in relative risk, we are calculating the incidence directly. We are seeing it develop. In the past, we did not see it develop. Because we did not see it, we are calculating the probability of its development. So that's just. Then quickly, let's go to the consistency of association. Here, consistency of association is inferred when the same result occur if repeated at different times, places, and persons. If you consistently expose people to, if you observe that people who are consistently exposed to something, to some noxious agent, maybe people who are consistently exposed to a particular chemical in an industry, all come with dermatitis, skin infection, maybe because of allergic reaction from that chemical. So if that consistency is there always, then you can infer causation. That's what he's just saying, that the observation that a consistent exposure to a particular agent causes the same reaction. But if exposure to that agent causes different reactions, then it is not. But consistency is inferred when the same result occurs if repeated at different times, different places, or persons. And you still have that consistent. Then specificity of association. Here it suggests that causal agent induces a single disease. And if another disease is exposed, for instance, tetanus, you cannot get tetanus if you are not exposed to tetanus bacteria. No matter any type of bacteria you're exposed to, it cannot be tetanus if it is not tetanus. So here I gave an example, vinyl chloride and angiosarcoma of the liver. Okay. Angiosarcoma of the liver causes, vinyl chloride causes angiosarcoma of the liver. Angiosarcoma is a cancer type, it's a type of cancer of the liver. A single dose example, lung cancer can have many causes, and single agents can cause many effects. Okay. Specificity can be diminished by an inappropriate or inaccurate grouping of disease in a way. If the diseases are poorly grouped, then you might not see the specificity, it will just vanish. Then temporality, or temporality, or we'll call it temporal sequence. That is one exposure leading to one outcome. If there is no exposure, there won't be outcome. You see, exposure, maybe exposure to scabies, exposure to somebody who is infected with scabies, leading to the mother outcome. That is biological gradient. Sorry, my network has been messing up. I don't know. All right, so let me just limit this. I don't know, my network is messing up. Let me just, okay, so biological gradient is talking about the greater the exposure, the higher chances of occurrence of a disease. Okay, for instance, it gives an example. Smoking cigarette increases the risk of cancer, lung cancer, for instance. So intense smoking increases the number of cigarettes the person smoke. The higher the number of cigarettes, the greater chances of developing cancer. In that case, that's what a biological gradient is talking about. Then biological plausibility, here talking about relationship between that suspected causal agent, and the suspected effect that should make sense. That is, every medical outcome has biological explanation. If it does not make biological sense, for instance, if somebody comes to say that taking tetanus injection causes hypertension, you begin to ask, what is the link? How? What are the processes that could lead to that? What are the biological explanations? If you cannot find a biological explanation to it, that is what we're talking about, biological plausibility. If you cannot find a biological explanation, if you cannot mount an experiment to show that, if you give tetanus injection, it will lead to this, from this, it will now lead to this, from this, it will now lead to this, and from this, it will now lead to hypertension. Immediately, there are gaps in those explanations. When you cannot see it, it becomes a guesswork. That is why is a nation that has scientific meaning or sense. If it is not explainable science-wise, if it's not explainable science-wise, then wise is useless. Then the other one is the coherence. Coherence here implies that the association be compatible with existing theory, hypothesis, and knowledge. It should, no one subject is a standalone. That is why each time when we are doing a research work, you say, look at what theories or what hypotheses exist, what are other people done. Like, so this issue, it has coherence, means looking at it is coherence with what other people would have also found in their own research, somehow for that thing effect to have occurred. So you must look at how is it able to occur? Does it coincide? Does it here is just like the opposite of it. The effect of removing B, then Right. Sorry, the network is not helping at all. Well, let's just run and see how much we can get out of it. Okay, that is it. We'll have to maybe I don't know. Okay, let me allow you to ask. Let me allow you to ask questions. Let me allow you to ask questions. So you can raise your hand. I can take this other one tomorrow and combine with whatever I'm doing. So please, you can raise your hand and see how far we can go. I want you to understand. Yeah, so there are several hands raised. China Zom, your hand is raised, so unmute yourself. And please unmute everyone, unmute yourself and ask questions. After that, Marilyn, your hand is raised again. Yesterday, your hand is raised perpetually and we called on you to ask questions. You did not. Okay, please unmute everyone so that the people can ask questions. So if now you can try to unmute yourself and see if it has been, the host has unmuted everyone. Okay, I am the host. Okay, sorry. Sorry.
Yeah. Okay, sir. Good evening, sir.
Good evening.
Sir.
Hello.
Please, sir.
Your background is noisy, please. Your
Okay, can you hear me?
background,
Can you hear me now?
your background is noisy.
It's some other person. Please, my question is. Hello, Prof. Can I continue?
Yes, please.
Okay, my question is, what could be the cause of postpartum for someone who has not had any history of hypertension, but probably during pregnancy and during the period the person gave birth to the other of her children? What could be the cause of it, and how can it be controlled?
What is the cause of, let me hear you, the cause of hypertension?
Yeah. For someone who never had it during the period of pregnancy, and during the period the person gave birth to other of her children, and is now having it after 3 months after giving birth.
And then it is possible that the person has gestational hypertension. You know, many times blood pressure increases during pregnancy, sometimes, and it's difficult. If you hold on, please. If you listen to me carefully, if you actually listen, I don't know why some people are so indisciplined. I don't know. If you know that your environment where you
mute yourself now.
If you know where you are is noisy, then you mute so that you don't disturb us. If you have to say something, then you unmute and say something and mute yourself so that you don't disturb the class. I don't know whether this one is difficult for, how can people adults don't understand this simple thing? No blame. All right, if you listen to the lecture carefully, I told you that when it comes to non-communicable diseases, it's difficult to pinpoint a particular cause. That is why we have web of causation. If you listen carefully, and hypertension is one of such. It's a non-communicable disease. So it's difficult for me to say this is the cause. What I suggest in such a case is that the person must undergo thorough medical examination. The kidneys must be checked. The kidneys. The person is advised to check the kidneys, do a kidney function test to include, up to creatinine and clearance. Kidney function test, very importantly when it comes to hypertension. Then there could be some endocrine diseases that can always also accompany hypertension. And also look at if there are stressors around the person, family level, number of children, and all that side. Baby, harmony in the home and all that. Whether the person actually wanted the baby or not. Because it's not every time the woman gave birth.
Hello, Prof.
Yes,
I lost at the
please.
point.
Sorry, my network. Yes. I was saying, if you listen to me properly, you will remember that I said when it comes to non-communicable diseases, there is a web of causation, and that it is difficult to pinpoint at any particular causative factor because it might be a combination of factors. And I said in the instance of this person you are talking about, we don't know if there is we don't know if there's any other health challenge, for instance. If there's a kidney problem, we don't know. We don't know if there's any other endocrine disease. We also don't know. So I was saying that my advice in this instance is for the person to go for a proper checkup. And they'll do a kidney function test and take it from there. You do a kidney function test and let's see if the solution can be found. That's my response here. It's difficult to pinpoint the cause because it's a non-communicable disease. Hypertension is a non. There could be other reasons. All right, the next. Bukola, are you there?
I'm here, sir. Good evening, sir.
Good evening. Ask your question, please.
Okay, I just have 2 questions on the theories. We had discussed 3 theories today, the agent-host theory, the causal ties, and the web of causation.
Yes.
So is it safe to say that the first 2 theories, agent-host theory, agent-host environment theory, causal ties, are linked or are applied only to communicable diseases, while web of causation is can be used to explain non-communicable diseases. Is it safe to say that?
Yeah, it's safe. Yes, you're right. Very safe.
Okay. My second question will be about the causal pies.
Yes.
Is it the whole 360 that is a sufficient cause, or just a segment of the 360, the circle, that is sufficient cause? It's a little bit confusing for me.
Okay.
And I've not gone.
If you look at it, that is why if you look at the 360, the entire pie is called the sufficient cause. And that sufficient cause has components, that is, there are pieces in them. You know, the way you cut your cake, you see those components. Those are the components. Those ones are the various factors that can represent other variables, maybe age, maybe exposure for one thing or the other, maybe malnutrition or anything else. So those are component causes, but the entire is a sufficient cause. What he's trying to say that each disease can arise from different sufficient causes. So for instance, those three you see, sufficient cause 1, sufficient cause 2, and sufficient cause 3, all will cause one disease. So each disease can cause by those 3 different sufficient causes. That's what he's trying to explain. But in those 3 different sufficient causes, the component causes are different, except one that is constant across. And that one that is constant, that component cause, that component that is constant across, shows that if that component is not there, then that sufficient cause will not be complete. And that particular component, like in that example, is A. That particular component is now called the necessary cause, because if you remove it, it will not occur. And if you read, you see the examples that are given there.
Yes.
Thank you.
Thank you very much.
Emma. Okay, the next. Augustina, can you unmute and ask your question? If you have asked a question, please bring down your hand so that I can know those who have not.
Hi, this is
Good evening, Prof. Good evening, Prof. This is Augustina. Can I go ahead?
Okay, go ahead.
Okay, sir. Please, I have 2 questions. One from today's class. Can I ask one from yesterday's class? I was unable to unmute yesterday.
Anytime.
Okay, sir.
Please.
Okay, sir. So for today's class, my question goes to that section of sensitivity. We talked about some sensitivity. My question is, that's stored
sensitivity.
Yes, specificity. Pardon me, please. So if your specificity suggests that the suspected causal agent induces a single disease. But in the second part, it talks about, okay, maybe a causal agent can induce many more, disease, or many more diseases can be caused by different causal agents. Does that still speak to specificity? And then the third point that you mentioned there, I don't understand it. If you can throw more light to it. Where you say specificity can be diminished by an inappropriate or inaccurate grouping of diseases in a way that obscures a real effect. I don't understand the statement, sir.
Okay, hold on. Let's get it clear. Let's go to that section and read it together so that. What section is that?
Specificity of association.
It's on causality, sir. It's on causality.
Under causality, yes.
That's it.
Prof,
Since that
25.
it is very frustrating today. I don't know what's happening with this network. So it's terrible.
It could also be that the reason could also be that the meeting is being transcribed live on YouTube for others who could not join. So it could also be part of the reason.
Because I don't know. This is very frustrating. You can imagine how many times who is transcribed.
The capacity of the meeting, which is maximum, so it couldn't hold on to everybody.
I don't know.
So we have to transcribe it lively, so those who could not join can follow through on YouTube.
This meeting is being sent to one or more. Okay. It's concerned. I don't even bother myself with a transcription or whatever.
In another way to lessen the burden on the network, if you can even stop your video, it will also go a long way.
Right. Yes. So okay, let everybody. My video is now out. Let every other one also, please. If there anybody whose video is on, just stop. Let's see whether we can have some sanity with it. Now it's saying, while this may, please, the person who has a question, you can see it before you, because that was why I gave it out for you to read. And when you read, don't be too fast so that you can, You say, while this may apply to a few associations between exposure and disease, example, vinyl chloride and angiosarcoma of the liver, single diseases, example, lung cancer, can have many causes, and single agents can cause many effects. Example, lead at high enough level can cause increased blood pressure, neurological symptoms, reproductive health effects, and kidney damage. So one lead, look at how many cases it has caused. So in disease causation, one disease, one agent can cause B. That is why we to link
Hello, sir. I stay here. Couldn't hear you again.
Today, post network is really frustrating. So sorry. Maybe all of us can put off our videos to reduce the bandwidth.
I think the best thing we should do is ask him to send us the material, maybe with the recorded this thing, to be better for us. The network is very, very bad. It's not friendly today.
But I think we are also trying to ask questions to
can also
understand.
ask this question in the subsequent classes because the network is bad.
Please, let's be doing live classes, Biko, nothing like pre-recorded classes. Biko.
The recorded they are talking about is after the lecture that they will not send the recording. That's what they meant, madam. Not that they will just send recording to us.
Can we just wait for him to come up, please?
Let's wait for him to come up. And I see
network is.
the number of people involved
I
in the
am
class.
here now. This is all right. I don't know. The person that asked the question, can you hear me? I don't know if you succeeded in getting my explanation. I'm really sorry about this. The mess up with my network today. I don't know. I don't know what is. I know he used to give network give problem, but this one is.
It's even
This one is something else.
It's even worse in Acquire State.
Don't know. Today own is so. So the person that asked the question, I don't know if you got that question. It's right. If she got okay, please. That's the much I can explain. Read that question again. You will get the explanation. If you've been following. And the last part, which is says specificity can be diminished by an inappropriate or inaccurate grouping of diseases in a way that obscures a real effect. Example, grouping one rare form of cancer with other cancers. Here, we're saying that when you say specificity can, this set of diseases can cause so type of cancer, then you should be specific about the disease you are looking at. But if you now group it with a different forms of this thing, then it becomes difficult for it to apply in every situation. It will not apply in every situation. Okay, that is why that grouping, your classification must be very specific to that thing you want, not open-ended. Okay, Tanko Ibrahim, Yunusa, then before Christopher Essien. Please, quick, just ask, because I don't know what happening to my network. Just ask as much as quickly now that.
Okay.
Okay.
Good evening, sir.
Good evening. Just go straight.
Thank you for wonderful lectures. So my question goes on yesterday's lectures.
Yes.
Where you are explaining the climatic factors that lead to health conditions. I am from Taraba State, Mambla Plateau area, and you are explaining about the malaria is more effective when there is high temperature. So before in Mambla Plateau of Jambu area, we have never experienced even seeing mosquitoes there. But as times going now, the temperature remains less than 15 degrees centigrade, sometimes even less than that. But these times around, we experience high rate of prevalence of malaria cases, and also the mosquitoes are much. So please, can you more explain it to me? Why is it that? Why yesterday you explained that any temperature that is less than that, such malaria cases will not be much possible in such areas, and now we're experiencing it in our side. So what could be the problem?
I don't know. It's difficult for you. Say you. Well, I don't know. Did you? How did you measure the temperature? Did you actually measure the temperature, or you assume the temperature is 15? It's good when you are asking. Did you measure the temperature? How?
Yes. We have this.
Yeah. So what's the temperature in Mambila today?
Sometimes the temperature is fluctuating, sometimes 15, sometimes even 19, sometimes even 20, sometimes even less than that.
So, and listen, any fact I give you, anything I say, I don't do it by assumption. It's established fact from research.
Okay.
Okay. So, for you to dispute it, you have to carry out your own research. It's not by assumption. Otherwise, science is not made that way. It is studies conducted by people over years and found it to be so. It can be disproved if you want, but in that case, you must consciously measure the temperature. Okay. And before you can say, before you do that. Yeah. So next question, what do you want? What other question do you have?
That's all, sir.
All right. Okay, let's listen to Christopher. Christopher is saying, Usan, Dr. Mary Tebowe, SAVC. Go ahead. Go ahead, man. Ask your questions. Your hands is raised up. Unmute yourself and ask questions, please. Or if you are not there, Emwe Siri. Or is it network in your area? I don't know. Then Raphael Caleb.
Good evening, sir.
Good evening. Please
This is
go on.
Raphael Caleb.
Go
Yes,
on,
sir. Thank you. In this lecture we had today, we are talking about, you made mention, according to the note, there are 3 models. So,
yes.
but interchangeably, you are using the word theory. So it's hard for me to capture how many models do we have and how many theories do we have.
Okay, please use them as well. They are interchangeable. They are also theories or models. They mean one and the same thing. Depends on what you want to say. Or you can call it template, okay, or framework, whichever one that suits you. Because they are theories in a way. They are also models. Or you can call them theories. Just call them, okay, use the word theories. Use the word theory. Theory for disease causation, maybe that would be okay. Any other question? Any other question, Caleb? Okay, any other hand that is raised, please, you can unmute yourself and ask question. Jane Onodugo. Are you all muted? What's the problem? You raise your hand, you are not talking, or you don't hear? I don't understand. Can't you hear me?
Hello, sir.
Yes, please.
Sorry, mine is just a clarification.
Okay,
On the
please.
theories, are they
Yeah.
actually three or 4? Where do we classify the Hill's criteria of causality?
That one
is it part of the model?
His classification, well, is slightly different, but they will. But his classification is a little bit more, it's a little bit different from it's a little bit when we are looking at a particular disease. We want to say, oh, before we say this disease caused this, we must look at these criteria before. So his classification is like criteria for disease causation is slightly different from this. It's just slightly, but they are all, causation is slightly different from maybe causal pies. I would not typically them there, but I don't know. They are similar, but it's slightly different. His is a bit more specific, different. The other ones are a bit more general. His is when we come to a particular disease. Okay, the network, I thought it's only my side. It's terrible. I don't know what's happening today. Bala. All the people whose hands are raised, can you unmute and ask questions, please?
Good evening, Prof.
Yes, good evening.
My name is Okpele.
Okay, go on.
So my question about my question is about yesterday's lecture, sir.
Yes.
When you mentioned cyclic fluctuation,
yes,
that this results into given immunization at the occurrence of a particular disease. Sir, what about the immunization? Sir? Hello, sir. Can you hear me, sir?
I can hear you. Repeat what you said.
You mentioned cyclic
fluctuations. Yes.
Yes, that when it occurs that they give immunization.
When it's suspected. Yes.
When it reduces the occurrences.
Yes.
Sir, what about the regular immunization given to babies at birth? Under which of this trend can we group it, sir?
The immunization given to children is
yes, the normal one from 0 at birth to like until they finish the immunization.
I understand. Immunizations are different. What the cyclic fluctuation is, as I told you yesterday, is when diseases occur in certain cycles of 2-3 years. Now, when you look at immunization, there are two important ways we do immunization as a policy in our country. One is routine or basic immunization. Some countries call it basic immunization. We will call it routine immunization. And we have two strategies. The first strategy we call is the fixed post strategy. That fixed post strategy means a mother, you take your children or your child to the health facility to be immunized. That's the fixed post on prescribed intervals of time. That's the fixed post. The other one, the supplemental immunization is the other type. It might be carried out through outreaches, immunization outreach, like neonatal, maternal neonatal immunization week. Every year there's a week where that is brought out to carry out immunization or other primary health activities, or where there is data suggests that there is an outbreak, then immunization can be done to contain that outbreak in that area. You can do a mop-up immunization. You can carry out national immunization days. You can see, or state immunization days, where the state will just immunize. Maybe looking at the epidemiological data in that state, you can decide to carry out that immunization to prevent outbreak. So if you now look at cyclic fluctuation and you have to carry out immunization, then it's a supplemental immunization. It's a supplemental immunization which is done to supplement whatever that has been done before. So you can classify it, yes, as a supplemental immunization. You can even have mop-up and the rest of them. When you ask primary healthcare workers, you see these are the various methods. Are there any other person?
Okay, good evening, Prof. Good evening, Prof.
Good evening. Ask your
Please,
questions.
Prof, is Marilyn. Since yesterday, I've been unable to unmute myself. Even when you are calling me today, so even a lot of persons they want to ask questions, but
thank God you succeeded.
Thank you, Prof. My question was the lesson we had yesterday. I don't know if you can hear me.
Oh, the noise around can't make me hear you now. So go ahead, my dear.
Okay, sir. The question I'm asking is based on the lecture we had yesterday when we talked about typhoid maybe. So my question is it possible for someone to have typhoid and be asymptomatic, like the person does not have symptoms, meanwhile the person has typhoid? Yes. Is it possible, and what could be the cause?
Yes, it is very possible. It is possible. This question you ask actually, this question you ask is maybe jumping the gun, because this would have come up in the next lecture, okay, or subsequent lecture. Okay, let me tell you, but let me explain to you. There are different types of. Oh God. If you are not asking question, can you please mute yourself? After which you can unmute yourself. See, there are disease states and there are disease carrier states. A disease carrier is somebody who has an infection, but the person does not manifest the signs and symptoms of that infection, and the person is able to transmit that infection to other people. And when you transmit that infection to other people, those people will now manifest it. You see, so carrier state exists. Typhoid is one particular disease that has a lot of carrier state. There are different types of carrier. There is something we call an incubation carrier. That is our incubatory carrier. That is the person, a typical example is HIV. At the window period of HIV, maybe 3 months, 4 months, when it has not actually manifested in that individual, the person can transmit the virus to other people. Then you can have convalescent carrier. You can have convalescent carrier. People who are able to transmit the disease, they are recovering from the illness, right? They are no longer in distress. They are recovering, but they are not fully recovered. They are well enough to stand up, to do a few things, but they are in the process of recovery. But even at that stage, they are still transmitting the disease to people. That's convalescent carriers. Then you have healthy carriers, like the typhoid Mary Marlon I explained. That's a healthy carrier. That one is not sick, but is able to transmit the disease to other people. And such people are a huge problem in public health because we don't know them. Then, for others, the manifestations of signs and symptoms will compel the persons to take treatment, even if it's self-medication or go to hospital. But when somebody is not feeling any signs and symptoms, the person appears to be well, the person will obviously not take any form of treatment, and the person is transmitting the disease. There are several There's different type of diseases. So I think there's a lecture on that.
Okay. Okay. Thank you, Prof. Thank you so much. Thank God I
Yes.
escaped.
Okay, I have a question.
Please speak up, and go
I
on.
have my
Go on,
question
please.
is,
Yes.
can you give us a distinction between causality of disease and risk factor? And then during public health interventions, what comes first? What is the priority? What is the targeted intervention? Is it more emphasis on causality or more emphasis on the risk factor?
Okay, let me, the risk factor is the emergence of the risk factor is where we have, again, you are jumping the next lecture. I would have to, this is under levels of prevention. Okay, under levels of prevention, we have different levels. The primordial level, primary level, secondary level, tertiary level. The primordial level is directed at emergence of the risk factors. Take, for instance, if you have adolescents at home and they are growing up, and we know, let's go back to smoking and the various health effects, and or alcohol, and you don't want the person ever to imbibe that culture or anything, then you do a type of intervention or health promotion that discourages the risk factor from ever emerging in that individual. Like health promotion, we call that, say, maybe we have to use a policy. It can be one. You can also use health education. Health education. If the person is consciously well educated about the consequences, and the person will swear never to have anything to do with cigarette smoke, and so that is the risk factor. Then when you're talking about causality is huge, because of a truth, it is not only smoking that can cause lung problems or even lung cancer. That's what I'm trying to say. Causality can be varied. It can be varied, particularly when it comes to non-communicable diseases. It is difficult to pinpoint, and that is why many times, even in the clinic setting, what do we do in practice? Many times, you go to see the doctor, and after listening to the complaints, you see the doctor scribbling some tests, say, do this test, do this test, do this test. Haven't laid your complaint and haven't examined you physically, perhaps, the doctor has made up his mind that it is like these complaints are likely due to so. However, let us rule out the possibility of this, and this, or let us further confirm this with this, so that we are much more certain. That is, I don't know if I answer your question. That's how it works. Why? Because certain presentation of illnesses can come from various causes. One disease can cause different manifestation. One, maybe bacteria, can cause different manifestation. And one manifestation can come from different, one disease or one infection can cause different manifestation. And one particular manifestation can come from different causes. You see, so because of that, it gives that confusion, which means you have to devise means to tease it out so that you are surer. That's how it's known in science. And that is why when somebody involved in self-medication, for instance, that, oh, I suffered from this the other time, and I took this, and I got better. Fine. It does. Person. That is why we I don't know if any person at all is doing nothing. Sorry, I don't know. Yeah, the thing is just be taking me off and on. All right, that's that. I just hope you had me. I don't know. This is just so frustrating. All right, any other question, please? Before I just have the next 2 minutes.
So you would have finished the ending part that you were talking about self-medication. You didn't finish it. You didn't get you clearly.
I was saying that is why we do not suggest, we do not permit or encourage someone to say, oh, because the disease, a lady suffered from something similar, like that looked like this, and they went to hospital and they gave him or gave her so, and she got better. What I'm suffering from looks like that. Therefore, I will go and buy those drugs and take. If you do that, you are just playing into the hands of these factors. From what I've explained to you today, you will know that it's not 1 + 1 is 2 when it comes to diseases. No, because it varies. And that is why even the practitioners use various means to arrive at what they think it is. Otherwise, everything would have been so simple now, very simple, but it's not as simple as we think. Next, please, somebody saying that he's muted. Unmute yourself. Please unmute everyone. If they are not muted. All right, Dr. Mary.
Everyone can talk. Yeah,
everybody.
This is
Hello, sir.
I'll be leaving in the next 1 minute to go have another meeting. I've been calling.
Marty online, sir. Good evening, sir.
Yeah,
sir, I have. Hello, sir.
Go ahead.
Yes. Looking at this view on multifactorial causes of diseases, sir.
Yes.
Will one have to subject this criteria of strength down to coherence on one cause and effect relationship, sir?
But if I understand you, are you trying to say before you infer causation, whether you will go through all of them?
Yes.
No.
Yeah.
No.
Secondly, sir.
Yes.
Yes, sir. Yes. Looking at this disease being caused from many factors, can one begin to look at it that the level at which a disease is controlled, depending on understanding the magnitude of one of the causes?
Okay.
Because sometimes it may not be possible to prevent all these factors. But one will be able to look at the factors based on their magnitude. So I'm saying will prevention of these diseases based on the knowledge of the magnitude of these causes from their distinct, factors?
Okay, let me answer. It shows me when you ask the question, if you had read it, you will not have asked the question, because it is clearly stated that you can't, for you to control the disease, you are not expected to identify all the causes. No, because you might not be able to identify all the causes. For you to control the disease, identifying and controlling one is sufficient. The same thing I said in that environment, host, and agent triangle, that once you're able to break the chain by one action, you will control it. Okay, let me give you specific example. Take for instance, when we had COVID-19. All these people who are putting their thing on, man. Take for instance, when we had COVID-19. Now, all we wanted to do is to prevent somebody from contracting the virus. So one of the measures was observe a distance of at least 2 meters.
Yeah.
Because we know that if you observe a distance of about 2 meters, you are not likely, if somebody coughs or sneezes and emits the virus might not get to you, because the virus is not airborne.
Yeah.
And it's going to drop on the ground because of the weight by gravity before that period, before that distance. So that is one, maintaining distance. So if people maintain distance adequately, that intervention alone can reduce a lot of, control a lot of that infection. Then if people use masks, for instance, it means it will limit the process of coming out from even infected individual one, and it will prevent it from entering another individual's nostril. So if people can use mask also, it can also, all we are trying to do is just to make sure that the virus does not get to the host. That is, we break that distance between the agent and the host. We are trying to break the distance between the agent and the host, either by increasing distance or by using a mask. Then we can break the distance, but we can break the link between the agent and the environment by one, keep on hand washing from the other angle, hand washing repeatedly all the time, regular hand washing, one. Secondly, we can cleaning of surfaces using hydrogen hypochlorite, sodium hypochlorite, bleach all the time. Yeah. So we are trying to break it also from that angle. So when we do this, we're able to control it. And we did it in Nigeria, and we controlled it here reasonably. Okay, my time is up. I'm sorry. Those of you, you can continue tomorrow.
Thank you, Prof.
My time is up. I have to join another meeting at 7 o'clock. I'm sorry. So,
thank you.
Thank
you so much.
Thank you, sir.
Thank you, sir.
Thank you, sir. Good night, sir.
Thank you, Prof.
Thank you, Prof. Thank you.
Thank you, sir.
Thank you very much.
Thank you, sir.
Thank you. Thank you.
Thank you very much.
Thank you, sir.
Thank you,
Can we
Prof.
conclude our meeting?
Thank you.
Thank you.
Thank you, Prof.
Thank you, sir.
Thank you, sir.
Thank you, Prof.
Thank you. This one, another, this one, nine panel a day for
Man, you could have came up and not talking. Yeah?
I will make the host listen us.
But you are telling child I want to do something and that they learn, you know, sir, they learn. Now make it simple. Not be for you to carry me to give them. You tell them